So I'm Dr. Phil Watt. I'm a consultant in intensive care here at Kettering General Hospital. We're currently on the intensive care unit where we are caring for the sickest patients with coronavirus.
There is nothing usual about what Dr. Watt is doing. The concentration is so intense, the silence here sobering.
We did at one point have all 15 available beds occupied. That was quite a significant stretch for us.
He is used to the critically ill and dying, but not like this.
It was remarkably stressful for the first few days because we didn't know when it was going to end. We didn't know how bad it would get, and I think the high mortality of this condition when they get to the point of being in critical care is also, very disheartening for some.
Hard to deal with.
Yes, absolutely, yeah.
Every patient we saw here was sedated and on a ventilator. Staff had just turned this woman, hoping it would improve her oxygen levels. But so savage this virus, these patients are constantly treading a fine line between life and death.
She's fairly well before this, and now she's not doing well at all. She's been like this for about a week now.
Yeah, that seems like a long time.
It's a long time to have such low oxygen levels, yes.
Yeah, not necessarily a good sign.
It's not a good sign, sadly.
The majority of the patients here have been on the intensive care ward for a very long time. Many of them have been ventilated for more than 3 weeks, but that isn't unusual with coronavirus patients who are critically ill, and that is partly because there's no specific treatment for them.
It's just a sort of daily struggle, really, with changing the ventilator settings, trying to optimise oxygen levels, carbon dioxide levels.
He's very young, isn't he?
He's relatively young, yes. And we've certainly seen a spread of age here. It has not been, I would say, exclusively for the elderly, this condition. Our average age, I believe, is 58.
My name's Louise Hyde. I'm a matron at Kettering General. We are on the urgent care wards where we currently admit all the patients with suspected or positive coronavirus.
One of Louise's patients on the ward has just passed away. With no family here, it was left to the nurses to share her last moments. Hannah cared for the elderly patient and was taking a knitted heart in to leave by her side.
Is that tough for you?
Yeah, it's my first one, so it's like COVID patient. So yeah, it's tough.
You all right?
Yeah.
Managing the well-being of her staff is the biggest challenge for Louise.
Patients are coming in, they are very sick, they're younger than we're used to managing, they can deteriorate really quickly, and when that happens, that obviously is quite an emotive area for the staff to manage, and it brings the reality of it all very close to home.
Hello Robbie, it's Ruben. Can you tell me what's going on?
Medics with a patient in the high-risk area are trying to contact the ward doctor.
We've got a young gentleman who is not doing too well at the moment, so just keeping a close eye on him. But yeah, that's how things are every day actually. And let's see how things are going on.
You have some patients that can suddenly deteriorate.
Yeah, they do very quickly, unfortunately.
A heart is hung on this tree for every COVID patient that's died here. When this virus comes to visit, it is nobody's friend. But staff want families to know that they were there at the end. Emily Morgan, ITV News in Kettering.